Let's talk about the Wisdom study, how to get free genetic testing, and what this means for the future of breast health. We are told to wait until we are 40 years old to get a mammogram. We are also told that we are too young to have breast cancer. As someone who's 34 years old with stage 4 breast cancer, that's just simply not true anymore, and something needs to change. Some people do think that mammograms need to be accessible at a younger age, and I don't think that's necessarily the case. And I do think this is what the Wisdom study is trying to actually prove. What does need to happen is a more personalized approach and conversation between the patient and their doctor. And that starts with monitoring their family history. Who has had any kind of cancer, man or woman, in their family history? What genetic screening have they had done, and what genetics are impacting the increased chance of breast cancer? This is a DM that I just got. She signed up for the Wisdom study, and it's messages like this that remind me why it's so important for me to be promoting this. The Wisdom study is a nonprofit. It is looking to improve the lives of women, and especially women of color. If you know someone who should be tested, please tag them in this video. It is so important for us as women to be proactive on our health and have more in-depth conversations regarding our history. Unfortunately, had I waited till I was 40 to get a mammogram, I don't even know that I would be alive long enough to have reached that point. I'm gonna link all the details in the caption on how to sign up. If you've signed up before, please leave a comment and encourage other people on how easy it was. If you don't qualify for the free one because you're out of the country or you're under the age of 30, I'm gonna put details in the comments as well on how to do genetic testing. A lot of people do worry about genetic testing and life insurance. I will say life insurance has more to do with a pre-existing condition, so breast cancer, versus genetics that potentially increase your chance at breast cancer. Always talk to a professional when it comes to that. Do your due diligence in getting stuff set up. When it comes to life insurance, especially if you are about to be diagnosed with breast cancer, I remember those early conversations I had as we were approaching the biopsy stage. But anyway, this is great. I think this is going to be the future of breast health and just creating a more personalized approach and conversation with women so that we aren't just waiting for 40 for that standard mammogram.